ಸೊ ಟೊಬ್ಯಾಕೋಯಿಂದ ಒನ್ ಟೈಪ್ ಆಫ್ ಆದರೆ, ಮತ್ತು ನೀವು ಇನ್ನೊಂದು ಹೇಳಿದ್ರಿ ಹೆಣ್ಣು ಮಕ್ಕಳಲ್ಲಿ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಜಾಸ್ತಿಯಾಗಿ ಕಂಡು ಬರ್ತಾ ಇದೆ. ಸೊ ಅದಕ್ಕೆ ಒಂದು ರಿಲೆವೆಂಟ್ ಪ್ರಶ್ನೆ ನಾನು ಕೇಳ್ತೀನಿ ನಿಮ್ಮನ್ನು. ಹೆಣ್ಣು ಮಕ್ಕಳಲ್ಲಿ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಕಂಡು ಬರ್ತಾ ಇರೋದಕ್ಕೆ ಫಸ್ಟ್ ರೀಸನ್ ಏನಿರ್ಬೋದು ಅಂತ? ದೇರ್ ಆರ್ ಸೋ ಮೆನಿ ರೀಸನ್ಸ್ ಮೈಟ್ ಬಿ. ಲೈಕ್ ಅದರಲ್ಲಿ ನಮಗೆ ಒಂದಷ್ಟು ಮಹಿಳೆಯರಲ್ಲಿ ಈ ಎಪಿಸೋಡ್ ನೋಡೋರ್ಗೆ ಅನಿಸ್ತಾ ಇರತ್ತೆ, ಬ್ರೆಸ್ಟ್ ಫೀಡಿಂಗ್ ಮಾಡ್ದಲೇ ಇರೋದ್ರಿಂದ, ಅಥವಾ ಕೆಚ್ಚಲು ಕಟ್ಟೋದು ಅಂತ ಹೇಳ್ತೀವಿ, ಹಾಲನ್ನು ಉಣಿಸ್ತಲೇ ಇರೋದು ಮಗುಗೆ. ಸೊ ಆ ಥರದ್ರಿಂದ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಬರೋ ಸಾಧ್ಯತೆ ಇದೆಯಾ? ಅಥವಾ ಚಿಕ್ಕದಾಗಿ ಹೆಣ್ಣು ಮಕ್ಕಳ ಎದೆಯಲ್ಲಿ ಗಂಟು ಕಂಡು ಬರುತ್ತೆ. ಲೈಕ್ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್, ನನಗೆ ಗೊತ್ತಿರೋಂಗೆ ನನ್ನ ಫ್ರೆಂಡ್ಸ್ಗೆ 1-2-3 ಜನಕ್ಕೆ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಇದೆ. ದೋ ಈವನ್ ಅವ್ರಿಗೆ ಮಗು ಆಗಿದೆ, ಇನ್ನೊಬ್ಬರಿಗೆ ಮಗು ಆಗಿಲ್ಲ, ಬಟ್ ಆದರೂ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಬಂದಿದೆ. ಸೊ ಐ ವಾಸ್ ವಾಂಡ್ರಿಂಗ್ ಟು ಫೈಂಡ್ ಔಟ್ ದ ರೀಸನ್, ವಾಟ್ ಈಸ್ ದ ರೀಸನ್? ಯಾಕೆಂದರೆ ಒಬ್ಬರಿಗೆ ಮಗು ಆಗಿದೆ, ಆದರೆ ಬ್ರೆಸ್ಟ್ ಫೀಡ್ ಮಾಡಿದ್ದಾರೆ, 2 years ಬ್ರೆಸ್ಟ್ ಫೀಡ್ ಮಾಡಿದ್ದಾರೆ ಆ್ಯಂಡ್ ಕೇರಿಂಗ್ ಇದೆ, ಆದರೂ ಕೂಡ ಅವ್ರಿಗೆ ಕ್ಯಾನ್ಸರ್ ಬಂದಿದೆ. ಐ ಡೋಂಟ್ ನೋ ದ ರೀಸನ್. ಐ ವಾಸ್ ಹ್ಯಾವಿಂಗ್ ಅ ಬಿಗ್ ಕ್ವಶನ್ ಮಾರ್ಕ್. ಆ್ಯಂಡ್ ಫಾರ್ ಒನ್ ಆಫ್ ಮೈ ಫ್ರೆಂಡ್, ಶಿ ಈಸ್ ಅಬೌಟ್ 28 years, ಅವಳಿಗೆ ಮದುವೆ ಆಗಿಲ್ಲ, ಮಗು ಇಲ್ಲ, ಆದರೂ ಕೂಡ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಇದೆ. What might be the reason?
Akash, everything, as I said, is not one factor which determines. So most important reason for breast cancer is hormones. It could be your period starting early, your periods getting over late in life. It could be 55, it could be 60. You're having kids at a later point age, or later age. It could be in your 30s, or it could be in your 40s, or not having kids, not having breastfeeding. This will increase your hormone exposure. But this is not the only factor. There are other lifestyle factors, your diet, your stress levels, your genetic factors. These also contribute. So it's not one thing which determines. And unfortunately, we see a lot of patients in their 30s and 40s developing breast cancer. Some of them, as you said, did not have kids and have. And quite a few are actually taking treatment for fertility. They are taking IVF treatment and they are diagnosed with breast cancer. So there are certain hormonal imbalances which is causing cancer, but hormones is not the only reason. It could be multiple factors. And when you are analyzing one patient, you have to keep everything in account. You have to keep the family history in account, hormonal factors in account. You have to also keep the environmental factors in account when you are deciding this.
Okay, one most googled question. ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಬಂದವರು ಕೂದಲನ್ನ ಯಾಕೆ ತೆಗೆಸ್ತಾರೆ?
They when you're telling them that treatment will cause, so they go and remove. Your chemo may kind of have hair fall. That's when they remove. So breast cancer has no connection to hair fall other than treatment.
So for the sake of treatment, they remove their hair.
No, they don't have to remove hair because of treatment, but with treatment your hair will start falling. And when they start falling, you may have uncomfortable time. You have, while eating food, you will have hair falling. In your pillow you will have. So sometimes it is always good to get a clean shave, so you are not having that problem that one hair is falling here, one there. So just for hygiene's sake, there's no direct connection between why you're removing hair after diagnosis of breast cancer. Nothing like that. After treatment, if at all you find it inconvenient, then you can get hair trimmed, or you can actually just it will anyway start falling, but at the same time, as soon as treatment is stopped, it will come back as well. So the first thing we tell our patients, it may take some time for hair to go, because some of the type of cancer, some of the type of cancer treatment, not all cancer treatment, may cause hair fall temporarily during the time treatment is going on. But later on, you will have normal hair. Actually, hair become more curly, sometimes can become healthier. So no direct connection with...
So just because for the treatment sake, after getting the treatment, it starts falling. So ಅದಕ್ಕೋಸ್ಕರ ಹೇರ್ನ ರಿಮೂವ್ ಮಾಡ್ತಾರೆ, ಹೈಜೀನ್ ಮೇಂಟೈನ್ ಮಾಡೋದಕ್ಕೆ ಅಷ್ಟೇ. ಓಕೆ. ಆ್ಯಂಡ್ ತುಂಬ ಜನರಿಗೆ ಅದು ಒಂಥರ ಮನಸ್ಸಲ್ಲಿ ಘಾಸಿ ಉಂಟು ಮಾಡ್ತಾ ಇರುತ್ತೆ. ಅಯ್ಯೋ, ನಾನು ಹೇರ್ ಫಾಲ್ ಆಗ್ತಿದೆ, ಎಸ್ಪೆಷಲಿ ಫಾರ್ ಲೇಡೀಸ್.
Most important concern for women is hair fall. So first important thing for us is we tell them what type of treatment we are giving. Will it cause hair fall or not? If it will cause hair fall, what can you do? So first thing I tell my patients is it's not permanent. It's a temporary process. It may happen in 3 to 4 weeks, and it will start coming back in 3 to 4 weeks of stopping treatment. That's the first thing. Second thing is, during this time, if you want, for personal hygiene reason, you want to get it trimmed, get it trimmed. Third thing is, during this time, there are so many extra things. You can use a cap, you can use new hair wigs or hair extensions. They look sometimes better than normal hair. Even a cosmetologist, even a cosmetic specialist will tell you that please go ahead and do these things. So basically, whatever makes you feel normal, whatever makes you have a good self-image is what you do. Some people will remove the hair and have a big tattoo on their scalp. So these are the things which actually make me feel so good, that how positively a person can handle it. That's the most important thing. How comfortably, how positively you can handle each situation. And family members will go and shave their hair just to support the patient who has cancer. It's lovely to see all that.
ಸೊ ಕ್ಯಾನ್ಸರ್ ಬಂದ ಪೇಷಂಟ್ಸ್ಗೆ ನಮ್ಮ ಜನಸಾಮಾನ್ಯರಲ್ಲಿ ಒಂದಷ್ಟು ಮಿತ್ಸ್ಗಳಿತ್ತು. ಐ ಹೋಪ್ ಸೊ ಅದಿವಾಗ ಆ ಥರ ಮಿತ್ಸ್ಗಳು ಇವಾಗ ಜನಸಾಮಾನ್ಯರಲ್ಲಿ ಇಲ್ಲ ಅಂತ. ಯಾಕೆ ಅಂತಂದರೆ ಮೋರ್ ಆ್ಯಂಡ್ ಮೋರ್ ಅವೇರ್ನೆಸ್ ಪ್ರೋಗ್ರಾಮ್. ಸೊ ಹಾಗಾಗಿ ತುಂಬ ಅವೇರ್ನೆಸ್ ಕ್ರಿಯೇಟ್ ಆಗಿದೆ ಜನಸಾಮಾನ್ಯರಲ್ಲಿ ಅಂತ ಹೇಳಿ ನನ್ನ ಭಾವನೆ. ಐ ಡೋಂಟ್ ನೋ, ಮೈಟ್ ಬಿ ಆರ್ ಮೈಟ್ ನಾಟ್ ಬಿ, ಇದೆ ಅಂತ ಅಂದ್ಕೊಂಡಿದ್ದೀನಿ. ಆದರೂ ಕೂಡ ಒಂದಷ್ಟು ಪ್ರಶ್ನೆಗಳನ್ನ ನಾನು ನಿಮಗೆ ಕೇಳ್ತೀನಿ. ಫಾರ್ ಎಕ್ಸಾಂಪಲ್, ನನ್ನ ಫ್ಯಾಮಿಲಿಯಲ್ಲಿ ಯಾರಿಗೋ ಒಬ್ರಿಗೆ ಕ್ಯಾನ್ಸರ್ ಬಂದಿದೆ. ಕ್ಯಾನ್ಸರ್ ಬಂದಿದೆ ಅನ್ನೋ ಕಾರಣಕ್ಕೆ ಅವ್ರಿಗೋಸ್ಕರ ಸಪ್ರೇಟಾಗಿ ಒಂದು ರೂಮ್ ಮಾಡೋದು, ಅವ್ರನ್ನ ಲೋನ್ಲಿನೆಸ್ಸಲ್ಲಿಡೋದು, ಆಮೇಲೆ ಕ್ಯಾನ್ಸರ್ ಅಂದಿದೆ ಅಂದಿದ ತಕ್ಷಣ ಅಯ್ಯೋ ಅವ್ರನ್ನ ಮುಟ್ಟಂಗಿಲ್ಲ, ಮಾತಾಡ್ಸಂಗಿಲ್ಲ ಅನ್ನೋ ಆ ಒಂದು ಡಿಸ್ಗಸ್ಟಿವ್ ಫೀಲ್ ಆಗೋದು. ಅವ್ರು ನೋಡಿದ್ರೆ ಈ ಕ್ಯಾನ್ಸರ್ ಇದೆ ಸೊ ಅನ್ನೋ ಒಂದು ಭಾವನೆಗಳನ್ನು ನಾವು ಹುಟ್ಟಾಕೋದ್ರಿಂದ ಅವರಿಗೆ ಯಾವ ಮಟ್ಟಕ್ಕೆ ಅದು ರಿಸೀವ್ ಮಾಡ್ಕೊಳ್ತಾರೆ ಮ್ಯಾಮ್, ಅವ್ರಿಗೆ ಅದು ಎಷ್ಟು ನೋವಾಗುತ್ತೆ, ಆ್ಯಂಡ್ ಯಾವ ರೀತಿ ಮನೆಯವರು ಅವರಿಗೆ ಸಪೋರ್ಟ್ ಆಗಿರಬೇಕು?
It's a worst thing to, again, most important thing is to talk to your doctor. The first thing I would want to tell in all this is it's not contagious. It's not an infection. You don't get cancer. Just because you are around a patient, you don't get cancer. Patient also doesn't get anything from you. That's the time they need you most, because that's the time you need to give love and care, and you should take care of what is happening with them. So please don't isolate them. They should eat from your same thali. You can go ahead and hug them. You can go ahead and kiss them. You have to be as good, as normal as can be. Plus, you should make sure they are meeting more people. They are kind of talking to them. They are expressing their feelings. And that's the time to not keep them away. There are very small instances when blood counts are low, or if the patient is already having a problem, then we'll tell them that time you should eat cooked food. You should put a face mask so that you don't get infection from other people. But that is only very rare situation, only very small amount of time, 3-4 days, that sometimes patient may have to go through this.
ಮೇಡಮ್, ಒಂದು ಹೆಣ್ಣು ಮಗುಗೆ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಬಂದಿದೆ ಅಂತ ಹೇಳಿದಾಗ, ಇದೇ ಸಿಚುವೇಶನ್ನಲ್ಲಿ ಇದ್ದಾಗ ಅವ್ರಿಗೆ ಯಾವ ರೀತಿ ಇಮ್ಯುನಿಟಿ ಅವ್ರ ಬಾಡಿಯಲ್ಲಿ ಲೋ ಆಗ್ತಾ ಬರ್ತಾ ಇರುತ್ತೆ, ಯಾವ ರೀತಿ ರಿಯಾಕ್ಷನ್ ಸ್ಟಾರ್ಟ್ ಆಗ್ತಾ ಇರುತ್ತೆ? ಅಂದರೆ ಸ್ಟೇಜಸ್ ಆಫ್ ಕ್ಯಾನ್ಸರ್ ಅಂತ ಹೇಳ್ತೀವಿ. ವಾಟ್ ಆರ್ ದೋಸ್ stages of cancer that related to breast cancer?
See, breast cancer, or most of the other cancers also, generally have 4 stages. And stage 4 is when it is spread to other organs. So if there is breast cancer and it has gone to any other organ like lung, liver, bone, this is stage 4. If a lung cancer has gone to brain, adrenal, it becomes stage 4. But all other stages, stage 1, stage 2, stage 3 are normally, stage 1, stage 2 are generally early stage. And stage 3 is generally locally advanced. Most of the time, stage 1, stage 2, stage 3 are curable stages. So when we decide stage, what we are deciding is what is the treatment we will give and how will the patient likely to do. And generally, stage 4 is not called as curable, but all other stages are called as curable.
And on what factors will you decide the stages of the cancer?
When we examine a patient, we get clues what is the stage. And plus, after examination, we ask for certain scans, and that scans determine what is the stage. So it's examination along with scans which decide what is the stage.
ಎಲ್ಲರೂ ನಮ್ಮಂಥವ್ರು ಕುತ್ಕೊಂಡು ಮಾತಾಡ್ತಿರ್ತೀವಿ, ಕ್ಯಾನ್ಸರ್ ಅಂದ ತಕ್ಷಣನೇ ಬಂದು ಸ್ಕ್ರೀನಿಂಗ್ ಮಾಡಿಸ್ಕೊಳ್ಳಿ. ಸೊ ಇವಾಗ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಯಾರಿಗೋ ಒಬ್ರಿಗೆ XYZ ಪರ್ಸನಿಗೆ ಇರುತ್ತೆ ಅಂತ ಅಂದ್ಕೊಳ್ಳೋಣ. ಸೊ ಅವರಿಗೆ ಗೊತ್ತಿಲ್ಲ ಅಂದಮೇಲೆ ಹೇಗೆ ಸ್ಕ್ರೀನಿಂಗ್ ಮಾಡಿಸ್ಕೊಳ್ಳೋದಕ್ಕೆ ಸಾಧ್ಯ?
See, screening is different for different gender and different age. But remember one simple formula, that everybody starting from 30 at least can go once a year to a doctor to get your history reviewed. You, again, as we discussed, that you could be an alcoholic or you could be a smoker. You could have a person in your family who has cancer, or you could have some other exposure which the doctor can understand. So talk to the doctor first, find out what is your risk, and then they will prescribe what are the blood tests you could do or what are the scans you could do.
So generally ವರ್ಷಕ್ಕೊಂದ್ಸಲ ಹೋಗಿ ಸ್ಕ್ರೀನಿಂಗ್ ಮಾಡಿಸ್ಕೊಂತಾ
Initially, at least once a year you should go.
Who is alcoholic and
Everybody starting from 30 years of age should go to a doctor once a year and at least get your history reviewed, and then they will tell you at 30 you have to do this, at 40 you should start doing this, at 45 you should start doing this. Get a plan for yourself. And then those things should be very meticulously followed. Once a year you should do one test, or 1 in 2 years this test is recommended, and you should regularly follow those. Screening by definition means when there are no symptoms and you're diagnosing a cancer. So screening are common cancers which are diagnosed without any symptoms. You don't go to a doctor with a pain and you are diagnosed with cancer, but you're just going as a healthy person and talking to your doctor, and then they will tell you, well, you're 21 years of age, let's start doing, a woman who's married should start doing a pap smear. If you're 30 years of age, let's do a pap smear with a HPV testing. So meet a doctor and get your recommendations.
ಅಂದರೆ 30 ವರ್ಷದ ನಂತರ ಒಬ್ಬ ಮನುಷ್ಯ ಯಾಕೆ ಸ್ಕ್ರೀನಿಂಗಿಗೆ ಹೋಗಬೇಕು? ಯಾಕೆ ದಟ್ ಪರ್ಟಿಕ್ಯುಲರ್ ಏಜ್?
Because most of the cancers happen in one particular age. If I'm talking about lymphomas, they happen at a certain age. If I'm talking about cervix cancer, it happens at a certain age. When we are talking about breast cancer, it happens at a certain age. So during that age group, the doctor will tell you these are the common problems which you can have, and so you should get yourself checked if you have a certain risk factor.
Cancer is also connected to the age number.
It is often connected to the age number, and cancer by definition is a disease of older age group, but it can happen in young people, it can happen in kids also. But then for kids we don't routinely check because they rarely happen in kids, and therefore for a kid they go when they have symptoms. But for an older person at a certain age, they may be at a risk of certain cancer, and that's what you do by doing screening.
ಓಕೆ, ನೀವು ಆಂಕಾಲಜಿ ಡಿಪಾರ್ಟ್ಮೆಂಟಲ್ಲಿ ಪ್ರಿನ್ಸಿಪಲ್ ಡೈರೆಕ್ಟರ್ ಆಗಿದ್ದೀರಾ ಫೋರ್ಟಿಸ್ ಹಾಸ್ಪಿಟಲಲ್ಲಿ. ಎಷ್ಟು ವರ್ಷದಿಂದ ಸರ್ವ್ ಮಾಡ್ತಾ ಇದ್ದೀರಾ?
In Fortis?
In Fortis, not only Fortis, professionally.
23 years.
23 years of service. ಕ್ಯಾನ್ಸರ್ ಪೇಷಂಟ್ಸ್ಗಳಿಗೆ ಟ್ರೀಟ್
From
ಮಾಡ್ತಿದ್ದೀರಾ?
2002 onwards, yeah. 23 years now.
Till now, counts ತಗೊಂಡ್ರೆ how many patients you might be have treated?
I'm sure lakhs of patients.
Lakhs of patients.
On a daily basis, sometimes we have hundreds of patients. So, I mean, yes, lakhs of patients.
My God, that's a huge number.
It also depends on the training, where you have trained, what is the number of patients which come in that institute. So, right from the time of your training, you see so many patients.
ಅಂದರೆ ನಿಮಗೆ ಅನಿಸಿದೆಯಾ ಯಾವತ್ತಾದರೂ ಈ ಕ್ಯಾನ್ಸರ್ಗೆ ಕೀಮೋಥೆರಪಿ ಅನ್ನೋ ಟ್ರೀಟ್ಮೆಂಟ್ನ ನೀವು ಮಾಡ್ತೀರಾ? ಬಟ್ ವಾಟ್ ಈಸ್ ದಟ್ ಕೀಮೋಥೆರಪಿ ಟ್ರೀಟ್ಮೆಂಟ್? ಹೇಗೆ ನೀವು ಒಬ್ಬ ಮನುಷ್ಯನನ್ನು, ಕ್ಯಾನ್ಸರ್ ಬಂದಿರೋ ಒಬ್ಬ ಮನುಷ್ಯನನ್ನು ಹೇಗೆ ಕನ್ವೆ ಮಾಡ್ತೀರಾ ದಟ್ ಯು ಹ್ಯಾವ್ ಟು ಸ್ಟಾರ್ಟ್ ಅ ಟ್ರೀಟ್ಮೆಂಟ್ ಅಂತ ಹೇಳಿ? ಆ ಕೀಮೋಥೆರಪಿ ಅಂದರೆ ಏನು?
See, chemotherapy has been the conventional type of treatment, one of the type of treatments of cancer. Chemotherapy are chemicals. There are certain chemical formulas which could be derived from a plant, it could be derived from a mineral. There could be various chemicals which have been tried and tested on one type of cancer, and now they are useful on you. So a fixed dose, a fixed chemical in a percentage, a proportion is given to you so that the cancer cells can be killed. But now there are newer therapies. Chemotherapy was older therapy, which is also used now. But there are newer therapies which are targeted therapies and immunotherapies. So they target only the tumor. Chemicals sometimes can be non-specific. They may go in a body and cause non-specific things, but basically target fast multiplying cells which are cancer. But there are targeted therapies which don't cause major side effect in any other organ, just go to the tumor and act. So they are like bullets, they go only to the place where it has to be attacked. Immunotherapies are immunity modifying treatment. They modify your own immunity to fight cancers. The immunotherapies could be injections, targeted therapies could be tablets, and chemotherapy could be tablets or it could be injections. So what we do now is mostly give combination of these, and there are certain indicators to decide what type of medicine will work the best in one patient.
ಓಕೆ, ಸೊ ಸೈಡ್ ಎಫೆಕ್ಟ್ಸ್ ಇದೆ ಅಂತ ಎಷ್ಟೋ ಜನ ಟ್ರೀಟ್ಮೆಂಟನ್ನು ಇಗ್ನೋರ್ ಮಾಡ್ತಾರೆ ಕೀಮೋಥೆರಪಿಯಲ್ಲಿ. ಸೊ ಏನು ಸೈಡ್ ಎಫೆಕ್ಟ್ಸ್ ಆಗ್ಬೋದು, ಅಥವಾ ಸಾಧ್ಯ ಆದರೆ ಇಟ್ ಡಿಪೆಂಡ್ಸ್ ಟೋಟಲಿ ಆನ್ ಪರ್ಸನ್ ಟು ಪರ್ಸನ್. ಐ ಆಮ್ ನಾಟ್ ಸೇಯಿಂಗ್ ದಟ್ ಮತ್ತೆ ಇದು ಬೇರೆ ಥರ ಕನ್ವೆ ಆಗಬಾರ್ದು ಆಡಿಯನ್ಸ್ಗೆ. ಕೀಮೋಥೆರಪಿಯಿಂದ ಯಾವುದೇ ರೀತಿ ಸೈಡ್ ಎಫೆಕ್ಟ್ಸ್ ಇಲ್ಲ. ಸೊ ಸೈಡ್ ಎಫೆಕ್ಟ್ಸ್ ಇದ್ದಿದ್ದೇ ಆದರೆ ಅದು ಒಂದು ಥೆರಪಿ, ಒಂದು ಟ್ರೀಟ್ಮೆಂಟ್ ಅಂತ ಕನ್ಸಿಡರ್ ಆಗಿ ಇವತ್ತು ಪ್ರಾಕ್ಟೀಸಲ್ಲಿ ಇರ್ತಿರ್ಲಿಲ್ಲ. ಬಟ್ ದೇರ್ ಆರ್ ಸಮ್ ಫ್ಯಾಕ್ಟರ್ಸ್, ಒಬ್ಬರು ಬಾಡಿ ಅದಕ್ಕೆ ರೆಸ್ಪಾಂಡ್ ಮಾಡ್ದಲೇ ಇರ್ಬೋದು. ಸೊ ಅದರಿಂದ ಏನಾದರೂ ಸಮ್ ಸೈಡ್ ಎಫೆಕ್ಟ್ಸ್ ಕ್ರಿಯೇಟ್ ಆಗ್ಬೋದು. ಸೊ ಅದ್ರ ಬಗ್ಗೆ ಡಾಕ್ಟರ್ನ ಕೇಳೋಣ. ಸೊ ಮ್ಯಾಮ್, ಏನಿರ್ಬೋದು? ಸೊ ಯಾಕೆ ಆಗತ್ತೆ ಆ ಥರ ಸೈಡ್ ಎಫೆಕ್ಟ್ಸ್? ಆಗಿದೆಯಾ ನೀವು ಟ್ರೀಟ್ ಮಾಡಿರೋ ಪೇಷಂಟ್ಸ್ಗೆ ಯಾರಿಗಾದ್ರು?
See, chemotherapy can cause cause side effects, yes, but with newer type of chemotherapy drugs, with a lot of supportive care, what we have been able to achieve is lesser and lesser side effects. But remember that you are targeting a very big disease. Cancer can be a life and death matter. So you are targeting a very big disease. There could be some side effects. They could be temporary side effect, but the objective is long-term benefit. You can have a small time side effect, but the objective is that later on life should be good. And the small side effects could be when you are putting an injection. Let's say we are just putting an injection. There could be sometimes pain here, discomfort here. Some patients could have vomiting, but now we have such extraordinary vomiting medicines that is taken care of. When a person is nutritionally not good, not eating enough, you already have cancer and you're not eating enough. You have a food pipe cancer or a stomach cancer, you're not eating enough. You have oral cavity cancer, you're nutritionally not good. When the medicines are given to you, they work in a different way. And that's why our first advice is nutrition should be good. You should have a healthy diet. You should be eating regularly, drinking a lot of water, taking a lot of vitamins and minerals as fruits, not supplements, but take lots of fruits, vegetables, sprouts, so that you have enough number of calories, you have enough nutrition which takes care of all these side effects.
ಥ್ಯಾಂಕ್ಸ್ ಫಾರ್ ವಾಚಿಂಗ್ ದಿಸ್ ವಂಡರ್ಫುಲ್ ಎಪಿಸೋಡ್. ಸೊ ಇದೇ ರೀತಿ ಪ್ರತಿಯೊಂದು ಎಪಿಸೋಡನ್ನು ಕೂಡ ವಿನೂತನವಾಗಿ ವಿಶೇಷವಾಗಿ ನಿರ್ಮಾಣ ಮಾಡ್ತಾ ಇದ್ದೇವೆ. ಇದಕ್ಕೆ ನಿಮ್ಮೆಲ್ಲರ ಸಹಕಾರನೂ ಇರಲಿ. ತಪ್ಪದೇ ಸಬ್ಸ್ಕ್ರೈಬ್ ಮಾಡಿ ಕನ್ನಡ ಪಾಡ್ಕಾಸ್ಟ್. ಹಾಗೆ ಈ ವಿಡಿಯೋ ನಿಮಗೆ ಇಷ್ಟ ಆದರೆ ಮಿಸ್ ಮಾಡದೆ ಶೇರ್ ಮಾಡಿ ಆ್ಯಂಡ್ ಡೋಂಟ್ ಮಿಸ್ ಟು ಲೈಕ್ ಅವರ್ ಎಪಿಸೋಡ್ಸ್. ಥ್ಯಾಂಕ್ಸ್ ಫಾರ್ ವಾಚಿಂಗ್. ಸಬ್ಸ್ಕ್ರೈಬ್ ಮಾಡಿ ಆ್ಯಂಡ್ ಬೆಲ್ ಐಕಾನ್ನ ಕ್ಲಿಕ್ ಮಾಡಿ so that every episode is gonna be notified. Keep watching. Spread smile forever.